questions at the end. So I'm going to launch into formally start the meeting. I want to welcome everyone to our monthly SimCity rounds. We have two wonderful presenters with us today, and I am going to do the introductions. So I'll start off with Howard Fruitman. Howie, to those of us who work with him closely at the CAMH Simulation Center. He's been an instructional designer for over 12 years, and he holds and med-ed in adult and community education, as well as a master's in English. He is currently an instructional designer on the CAMH Education, Simulation, and Digital Innovation team. How fortunate we are. And he's passionate about continuing professional education, digital learning, and medical simulation. He's also interested in best practices around EDI, equity, diversity, and inclusivity, and when it comes to training and simulation design and development specifically. He's been fortunate enough to explore and promote the use of EDI in education through the collaborative development of a health, equity, and inclusion framework for education and training, which you will probably be hearing more about in today's session. And next we have Dr. Jerry Maniate, who is a clinician educator at the Ottawa Hospital and an associate professor and an inaugural vice chair of member support in the Department of Medicine at the University of Ottawa. He is also the EDIA advisor and a researcher at the Bruyere Research Institute. He is the executive director and primary investigator of the Equity in Health Systems Lab, and some of us here are fortunate to be able to be members of that lab, which he founded in September 2021. So this lab is an international community of transdisciplinary researchers, healthcare professionals, educators, policymakers, learners, and patients who are seeking to make an impact on our community and health system with the work that they're engaged with through a unique approach. Jerry's academic work and that of the EQHS lab has been focused on understanding and addressing inequities, accessibility challenges, and social accountability within our health systems. And they're doing this through collaborative partnerships using a scholarly lens. So without further ado, I'm going to pass it over to Howie and Jerry, who will take us through today's presentation.
Thank you so much, Petal. I'm just going to share my screen with everyone. And also start, oopsie, 1 second, y'all. There we go. Okay. Everyone, welcome. Thank you for coming today. This has been a collaboration between the Equity and Health Systems Lab and the Center for Addiction and Mental Health. And we're presenting on incorporating diversity and equity, diversity, and inclusivity principles into simulation-based education, practical tips for educators. And I'm very happy to be here today doing this with my great colleague and friend, Jerry. I've been on, just a personal note, I've been on my own journey with respect to EDIA, incorporating best practices and enhancing my knowledge in my work as well as my everyday life. And, you know, I come to this space today with a great deal of privilege, but every time I get a chance to do these presentations, my hope is to use it as a place to learn from all of you and to reframe my own perspectives when discussing these really important topics. So basically, I'm here to learn just as much as you folks are today. And I'll pass it over to Jerry to introduce himself.
I think I'm just also very grateful for this opportunity to be re-engaging with this community. I was here as a speaker back in the fall, and I love the fact that many of you are continuing on this kind of journey and wanting to learn in this space. And so I think what I hope is that both Howie and I are also modeling for you through our approach that this is an ongoing, lifelong learning space where we're continuously looking to learn and unlearn in this kind of space as well. And so we welcome your thoughts, your comments as we go through.
All right. So just a note on our learning objectives for today, we're going to define equity, diversity, and inclusivity in the context of simulation-based education. We're going to describe factors that contribute to the creation of an equitable, accessible, and inclusive simulated learning environment. And last, we're going to discuss the importance of using what's known as the Health Equity and Inclusion Framework for simulation design and development, as well as delivery. And I'll get to that a little bit more later. Some of you may recall with regards to the last learning objective that Jerry actually presented a bit on this area back in the fall of 2023, if you were fortunate enough to attend. I'm just going to do a little land acknowledgement from CAMH. So just to let everyone know, CAMH is situated on lands that have been occupied by First Nations for millennia, lands rich in civilizations with knowledge of medicine, architecture, technology, and extensive trade routes throughout the Americas. In 1860, the site of CAMH appeared in the Colonial Records Office of the British Crown as the council grounds of the Mississaugas of the New Credit, as they were known at the time. Today, Toronto is covered by the Toronto Purchase, Treaty Number 13 of 1805, with the Mississaugas of the Credit. Toronto is now home to a vast diversity of First Nations, Inuit, and Métis who enrich this city. CAMH is committed to reconciliation. We will honor the land through programs and places that reflect and respect its heritage. We will embrace the healing traditions of the ancestors and weave them into our caring practices. We will create new relationships and partnerships with First Nations, Inuit, and Métis, and share the land and protect it for future generations. I'd also like to give a shout out to some of our contributors. Although Jerry and I are presenting on this, the presentation, the information, the data that we have collected was a very large collaborative effort. It included the CAMH Simulation Medical Director, Dr. Petal Abdul. It included the Director of the Simulation Center at CAMH, Stephanie Sleekers, as well as the Equity and Health Systems Lab Manager, Wendy Chong. So we thank them for all of their contributions and help with this. A little note on language before we begin. So Jerry and I both recognize that the words we use to discuss health, identities, and populations can have a powerful impact. We do make every effort to use language that is respectful, inclusive, and bias-free, but we also recognize the language is constantly evolving, and as societal values change over time, so too does the language that is considered appropriate. We strive to use language that celebrates the diversity of the communities we serve and remains respectful, inclusive, and bias-free. And as a part of our commitment to EDIA, we welcome feedback on our language and our language use, and routinely review our content, updating the language as needed. I'm going to ask for you all right now just to take a brief look at our group agreement. We like to have these before we do a presentation on this to ensure that everyone feels welcome and safe while participating today. We'll also be engaging with material that may act as personal stressors for you, which is why we strive throughout today's workshop or today's presentation to establish and maintain psychological safety. And our group agreement is the first step toward that. So I'll just ask right now for you all to take a look at this and to also please feel free to use the chat to add to this if you have any additional suggestions. This is not something that is set in stone or prescriptive, and we're always looking to enhance it. So we definitely welcome feedback on this. So before we begin today, I'm going to ask you to take a moment to reflect. And there's quite a few questions on screen here. I realize that. So you can choose one or two of them. We're going to engage with a case study later on today. And I'll mention these questions again before we engage with it. But essentially, we're asking you how you would approach the situation we're presenting. Think about strategies you would do to address it. What resources could you provide? And what could have been done beforehand to prevent any unnecessary risks. So don't worry about memorizing it. Take a look through it right now, and I'm going to circle back to it a little later on in our presentation. But we wanted to bring this up first, just so you have an idea of the way our conversation is going to flow. I want to recognize that today's workshop is in part based on the CAMH Health Equity and Inclusion Framework for Education and Training. This framework was developed as part of a coordinated effort to reform and/or improve all training programs to advance the principles of EDIA. The purpose is to promote equitable and inclusive learning environments and embed a health equity lens into the planning, development, and delivery of CAMH education training initiatives. And you will definitely have a chance later on today to access this document for your own use, as well as refer to it through our activity. So with that said, Jerry, I'm going to pass it over to you right now.
Thanks very much, Howie, and thanks for setting the stage and introducing those important points that help us frame the language, but also how we want to approach this work. This is SimCity round, so I think one of the really important things to think about is how do we take these concepts that we've been talking about with EDIA and bring them into this space? Is it possible? Is it impossible? Or do we have to be a little bit more creative in how we think about this? As you know, simulation is this experiential, hands-on kind of space. It allows for the real cementing of learning that takes it out of those classrooms, out of sort of the talking head kind of space and into the doing. And in the doing, there's a lot of really powerful learning that can occur. So it provides that space where the learners will have that shared experience. There's that debriefing opportunity, and it's in those debriefings as well. I found most of the time that that's where the learning for me was happening. It's not just in running the case or running the scenario. It's the conversations that happen. It's the unpeeling of the onion, as it were, the learning about power, the learning about hierarchy, speaking up, not speaking up, creating safe space. All those powerful lessons happen in that area of debriefing. But you can also see tensions that can happen depending on who your audience. You could take the same case, different groups of people, mix and match a few different individuals, and it's completely different experience, as you've probably experienced yourself. Microaggressions, bias, stereotypes, these things can percolate or sometimes even bubble over in those scenarios. So it's really important to think intentionally. How do we incorporate these principles of EDIA into our simulation so we can better support the learners, the faculty, the people participating in these scenarios, including the support staff that might be seeing what's actually happening as well. Next slide. As you know, there are many different forms of experiential learning. Simulation is one where you get scenarios. There's maybe some technology, but it can be pretty high technology as well with fidelity. We certainly have those clinical experiences. I'm in my scrubs right now, so I'm going to go to the ward right after this, and it's the patient. There's no technology that's sort of mimicking what we're trying to teach in that kind of space. So we call that pretty high fidelity. But then there's role playing and virtual reality. These are other spaces that we can try and work within. But for the purpose of our conversation today, yes, we think about simulation, but increasingly many of you are also getting involved in role-playing virtual reality kind of spaces as well. The principles, how do you take these principles and apply them there? Next slide. And so when we think about this, issues of EDI can come up in the simulation or the debrief, and it can happen whether you wanted to or you didn't want it to, the intended or unintended situations. So what we would argue or posit is that if we can intentionally at least think about these things a priori, we can, as faculty members and as educators, be better prepared for those inevitabilities, especially if those are the planned kind of spaces that we want to have these kind of conversations. Or if it unintentionally happens, that at least we have a framework, a way of approaching it. Next slide. And so we can use simulation to actually teach and assess very challenging topics. We do this all the time. You know, it's not just about suturing, right? Those are the very basic things that I remember as a first year medical student, and students from other health professions will have very similar, very low level kind of basic things that they'll do. But you can go to the very complex. They can be very elaborative, and push. And so one could see that in both the communication skills, starting up very, very simply, how do you even ask a question to a patient? But then it could be very complicated too. How do you de-escalate a patient or a family member of a patient who's quite upset because you've now just shared with them some very bad news, right? So there's an extreme when it comes to each of these domains. And we can use the simulation not just for those very basic things, but for the very complex and challenging ones. I think it's really important because as we look at real life, these themes, these concepts of EDIA just permeate everything we do. Like when I go to the ward right after this, I'm going to feel it and see it because I just felt it and saw it this morning when I was interacting with patients and families. Sometimes it's overt, sometimes it's not, but it's there. It's because we're talking about interpersonal space. And that's a really powerful space for simulation to really help our learners hone into before they get out onto those clinical spaces when it's a real patient that's actually in front of them or a real family member. Next slide. And so as we look at the spaces that we create, the learning environment, the work and learning environment, which actually are intertwined in our clinical spaces, we have to realize that we're embedding our learners in these kind of spaces. And so it's not good enough to just say we don't have ableism or harassment kind of stuff. We're not having overt racism. But we have to think about, are we creating psychologically safe spaces? Are these spaces actually warm and welcoming and create a sense of belonging? Now, why does this matter to simulation? Well, you think about it, depending on the type of environment that you've created for your learners, if they're not in a safe space, are they going to really authentically participate in the simulation scenario that you've created? It could be the most elaborate, the toughest, you've done a lot of personal soul searching to create that scenario, but if they don't feel safe, they're not going to participate. Likewise, if your faculty members are not feeling safe because they don't have that sense of belonging, they're also not going to authentically be able to open up and create the safe spaces because they have their own tensions that they're trying to manage and feelings as well. It takes time and intentionality. So we see this as a methodology that we place into an environment that needs to be optimized to the best of our abilities. And it's not simply just a matter of looking at the individual. It's all the way up to the policies and structures and the culture that we create. We need to create health promoting work and learning environments into which these type of methodologies are used. Next slide. And so there are different levels of psychological safety. Yes, inclusion. Yes, I'm at the table. That's great. But I'm not going to say anything because I'm scared to say anything. Will people judge me? Will people think that what I'm about to say is appropriate or welcomed? But we can continue from there, like not just a seat at the table. Maybe I can just ask some very basic questions, but the questions are so basic because we're not sure how we're going to be received. Can we push from there? Can we push into the space where we're collaborating with each other? So I can push a little bit, but I'm going to couch my comments and my questions. Or can we say, you know what, the emperor's not wearing any clothes right now? Can we challenge? Can we push into the space because we're seeing things from a different perspective? And we want to see that because that's how we're going to start identifying patient safety issues, quality improvement opportunities, and learning opportunities in these spaces. But most times, I would posit that challenger safety is not there. And as a result, you get a lot of people saying yes or no when that's what the leader wants them to say, but not really effectively managing and participating. Next slide. And so as we see, how can we integrate EDIA into simulation? Well, it can be embedded within the case itself, but it also has a place within the briefing. How do we set up the scenario? How do we create the space for those scenarios to be discussed and experienced, as well as the debriefing post? there are some very interesting principles that can be unearthed in these conversations. Conversations that not just limited to power, privilege, and perspectives, but these are three powerful things that you can do there that you can't necessarily just do in a classroom. You can do it to a certain extent, but it's interesting how the richness of the conversations that can happen when you've gone through a scenario. And how do you embed this kind of an approach? The approach that I've taken with the work that I do and how we've been trying to do it in the Equity and Health Systems Lab is founded on these concepts here. Creating a space where there's humility. The I don't know all the answers kind of an approach to life. I don't know about you, but I certainly don't know everything. And if I talk to my 8-year-old and 9-year-old, they remind me of that quite often. Um, and and when we go into our clinical spaces, we're taught in some ways, whether it's consciously or unconsciously, that we're supposed to know all the answers. You're supposed to have all the answers, doctor, or pharmacist or nurse, or why can't I do this, physiotherapist? You're supposed to have the answers. We're not really encouraged to say, you know what, I don't know. I'm going to go and look that up, or I'm going to call a friend and see if we can figure this out. This is complicated. That's where that humility piece comes in. And when it does it, what it does is it flattens the hierarchy and creates some space for you to start asking these kind of questions where the curiosity comes in. I wonder what matters to you, Howie, in this scenario, in this case, as we're talking about it, or to the patient. What matters to you? Allows you to not make assumptions, but actually allow them to break through and perhaps even shatter the stereotypes and the myths that you may have. Listening, reflecting on what you're actually listening to, so it's an active listening, and thinking, what am I unlearning and relearning in this process so that we can create that space. Imagine if you could use this foundational approach in your simulation. Could you get to richer, deeper conversations about power, privilege, and perspectives? I suspect that you could, because it's role modeled by the individuals who are the faculty and the educators, and those participating. Next slide. And I think I'm handing it back over to you, Howie, at this point.
You are. Thanks, Jerry. Um, so, having structure in your process when you're designing and developing simulation, or training in general, I should say, helps with consistency and or adhering to standards, meeting timelines, as well as setting expectations with your subject matter experts, as well as your planning committee. Um, as we know, there are many models of instructional design that can be leveraged to help with design and development. There's the Kern design thinking, the stepping stone models on right similarities. We chose to use the ADDIE model of instructional design, simple but tried and true. It covers many of the same aspects as other models and was used particularly for the framework I mentioned earlier on today. And it fits very nicely, I should say, with the simulation design and development process that we're going to go through, as well as it refers back to the ADDIE model. So what I have on the screen for you right now is a breakdown of the ADDIE model, and there are bullets that explain or provide info on what EDIA, equity, diversity, inclusion, and accessibility considerations can look like. You'll notice that there's only a couple for each of the stages that are listed here. In the actual framework, there is a much larger list, and it is by no means exhaustive. And again, when we share that framework with you, we're always looking for folks to read through and provide us with suggestions and recommendations on how to enhance it. So please don't hold back. I will say, though, some of the core elements here that we have on the screen. So for instance, when we're looking at the analysis phase, the very first one, an old mentor of mine taught me this, when designing and developing any type of training, be it simulation, e-learning, etc., always keep the learner participant in mind, the audience. Those are the individuals you will be catering to, and the ones who always have to be top of mind throughout the design and development process. So you want to make sure that in the simulation you're designing and developing is appropriate. Is it feasible for the audience to actually engage with it? Does the planning committee represent the intended audience as well? You need to have members of the learners, or sorry, representation of the learners who would be attending these simulations to help design and develop it. And that's a very integral piece. With respect to the design phase, you want to look at the simulation environment, the materials needed to accommodate different learning preferences, abilities. You want to gather background knowledge on these individuals, which you would do in the analysis stage, but then use it in the design phase to help build out and inform the simulation. And also, you want to make sure that the materials are accessible to all learners, regardless of things such as age or disability. Um, we do our very best to stick to the AODA Act, so the Accessibility for Ontarians with Disabilities Act, um, or the Accessible Canada Act. Um, and when we're looking at designing and at this particular stage, and we're keeping in mind the curriculum as well, we want people from our planning committee, we want individuals who we may have reached out to from the needs assessment piece or the analysis stage to also help inform the design process as well. That doesn't mean there has to be a whole massive review, but it doesn't hurt to lean into them every now and then for support, as well as to make sure you're including them in this design piece. For the development stage, some key things to consider are, for instance, does the simulation use plain language? A lot of people think that using plain language means a dumbing down of the information when that is not true. We all know that medical terminology and vernacular can be really tough for those who don't have a strong foundation or background in it. So it's okay to use plain language to help explain concepts, terms, theories, etc. You also want to, another big thing around the development piece is around demonstrating respect for racial, ethnic, cultural, and gender diverse identities. A great example of this that I've witnessed before, and that I know several other folks who I work with have encountered before too, is sometimes when developing a scenario for, let's say, a simulation, in this case, obviously, people might say, "Oh, I want to make the character in this of a different ethnic or cultural background." That's okay to do, but it needs to be done thoughtfully and with meaning, because otherwise it comes across as being tokenistic. And of course, this is feedback that we've received from folks, people with lived experience as well, who have expressed this to us. So again, it's about really creating things like case studies, simulation scenarios, or different activities that may involve characters and character development, that you keep in mind, what is the purpose of me saying this person needs to be called out for their sexual orientation or their ethnic background? What is that bringing to the table? How is this helping the learner along? How is it helping them achieve their learning objectives? With
Howie,
respect, yes.
as you were saying that, the tokenistic piece is a really important concern. But there's also the concern as well that you could be reinforcing stereotypes and myths, which are not founded on reality or facts or evidence. And so your comment about being really thoughtful. Why are we doing this? Why are we including that? Is it pertinent to the case? Is a really important set of questions to ask. Otherwise, you could be walking into a bit of a minefield yourself.
Absolutely, Jerry. Thank you for that great point. When we get to the implementation, God, I can't speak today, implementation stage, we want to look at, for instance, is the simulated environment respectful and supportive? Are faculty or facilitators comfortable discussing issues? We have some examples here, such as sexual orientation, racism, discrimination, but really, what we're asking in this case is for facilitators to be able to have tough conversations. And that doesn't mean that they have to be experts in EDIA, for example, but they need to be able to facilitate conversations. So we always say, control the context, but not the content. So when we're in a space, a learning space, we want people to have the psychological safety to be able to voice their opinions, their concerns, to challenge as well. And it doesn't mean that the faculty or facilitator has to be an absolute expert, but they should give the space for the individual to ask these questions, allow other learners to contribute and share in the discussion. And it's also okay to circle back to certain points as well later on. So for instance, as a faculty or facilitator, if you can't answer the question, would be great afterwards to search for an answer, engage the individual who asked it, share responses with the group afterwards to ensure that the learning doesn't just end when the simulation comes to an end. And lastly, I'll just cover evaluation here. So again, when doing an evaluation, post, you want to make sure that you're capturing feedback related to the learning environment, especially with respect to simulation. You can have specific questions related to health equity. So, things around, was it an actual equitable learning environment? Did people feel as though they could actually access the material, use the tools or apparatus that may be involved in the simulation? And it could also relate back to things such as psychological safety, which you can ask for a response to as well, and how to encourage and enhance that, because it will be different for everyone. So I know that was a lot that I covered right now, but
Howie,
yes.
there's a question in the chat from Sasha. Is a good enough reason to include social identifiers that are not cis white, white, cis, straight, simply to represent more diversity in teaching cases, even if those social identifiers are not directly relevant to the learning objectives?
That's a good question, and I think that we all might have different responses to this, but I asked, I mean, this is a hard question to answer, and I ask people to provide feedback in the chat, please, if you have any other suggestions. I think, the main thing that we wanted to take away from this is, Jerry, as you said, not to reinforce stereotypes, and doing our best not to be tokenistic. But it is a good question, because I guess the thing is I would say, do you have to gender the individual in the case study or in the scenario? Do you need to say that they're white at all? I mean, that could also come back to people making assumptions that if you don't include these identifiers, that they are white too. So I don't have an exact answer to
Yeah.
this. Does anyone else in the chat and the group, though, or Jerry, if you have a
Yeah.
response too?
This is a really good question, Sasha, and many people struggle with this because we've grown up with sort of that sensation that we have to have certain key details like age of the person, their gender, maybe a little bit about their background, and then we run into the story. That's how we present cases, right? Is sort of a stream of thoughts like that. But it goes back to, is it relevant to the case? So when we take a case of a heart attack, for example, are those identifiers critical to the management of that scenario and that case that you're trying to think about? Same thing about other topical spaces, right? So if we talk about substance use, are we using very unique identifiers in those kind of spaces? Are we simply drawing from biases that we may have about who those type of individuals may be? And in doing so, we may be placing risk of reinforcing those stereotypes. It's a tough thing. I think the question is, if it's pertinent to the case, it's important to include that. But if most of the time it's like filler words that we use because we think we have to include them in the conversation. That's gotten a few more chat comments in there, Howie.
Absolutely. I just wonder if, oh, sorry, go ahead, Jerry.
No, I was just going to read a few of them. Like Tucker says, my thinking around this is that ideally our actors should represent the demographics of the site, either who they're serving or should be serving. So that's an important way to think about it, Tucker. And knowing your community and the demographics and the needs will be a very important detail.
I wonder if it goes, I'm reading a comment here from Ellen that I think is excellent. Maybe it helps to communicate intent before the course when choosing a unique identifier that don't seem to be for an immediate purpose, but may. So I think in this case, I think maybe I conveyed the messaging incorrectly, but I think it's about understanding why we are using these unique identifiers. I think what we're trying to say is, don't just give an identifier because you feel like, I'm trying to give an example here. Say that every case study has been identified as a white character in the case study, and then all of a sudden you want to just include a Black character in the case study to show variety, if you will. That's not the best way to go about doing that. But I do agree that in terms of representing the environment or the context that you work within, sure. But I think it's also about having reflective thought along the way and thinking like, okay, what is the intent of this? Why am I doing this? And also having discussions with folks as well. Don't make these decisions on your own. Lean into your colleagues, speak to others around you, and have discussions about this too, because it's going to differ for every context.
And it's interesting, Tucker put this comment in, and I would agree, like the concept that you're trying to maybe surface differences in care and outcome, right? So, but then there's a purpose to those identifiers, right? Like that's your learning objective, and you're now bringing in pertinent details that will help reinforce the teaching around that kind of space. So discrepancies of care or disparities of care can be accentuated. So, and Asha, you said it right. It's got to be part of those learning objectives. So if you understand what they are, what the competencies that you're trying to achieve, then you can make sense of why those identifiers are uniquely placed there.
Okay. So I'm going to move on now to the last part of our presentation, which is a very, very short case study. So what we're going to do is we're going to go through this case study on the screen. You'll also see that there is a QR code there. If you open up that QR code, you should have access to the Health Equity and Inclusion Framework for Training and for Education and Training. In that document is a list of the various points to consider for each stage of the EDI model. You don't have to use our document at all or our framework. You're also welcome to just think of things off the top of your head or draw from your own experience, or to think back to some of the items that I had on screen previously. But what we want to do is to go through this case, and we're going to ask you for each stage of the EDI model what you would consider for that particular piece. So here we have a case study. You are about to begin a simulation on the application of mechanical restraints. The simulation is occurring in 2 groups. Each group will have a mannequin, one white and one dark skin, who they will have to restrain on a stretcher. So, based on the principles of EDIA, how would you apply them to the various stages of EDI? So, the case has already been created, but let's pretend we're going back in time here for a second, and we're at the analysis stage right now. What types of questions or considerations would you raise during this first stage, during the analysis stage? So again, this is where you're gathering all your information, you're getting to know the needs of the learners. This is going to help inform your learning objective development. What are some things you would consider? And think of it in relation to this particular case here, as short as it is. You can use your chat. You're also welcome to unmute yourself, although I can't see any of your lovely faces because I have the screen shut or the display shut.
So there's a comment here, and I apologize, I don't know the name of the individual from the U of T Surgical Skills Center. I see your face, but The comment was language issues.
It's Lisa,
It's
sorry.
Lisa.
Hi,
Yeah.
Lisa.
Hi.
Are we, sorry.
So sorry, I had to go off because of the overhead page.
No.
But Lisa, like you put language issues. Do you want to elaborate a little bit on that? What
Yeah,
thoughts did you have?
I think that sometimes we're so focused on some aspects of individual simulations that we forget that also the mannequins may not have language, but people do from different countries, from different ethnicities. And the assumption of being white and speaking English is sometimes an assumption that we make, whereas it could be somebody of a various different languages with different abilities of communication. So I think it's not just about look but it's also about hearing and speaking and being able to manage that appropriately as well.
Excellent. There's also,
Thank you.
thank you for that. Sorry, were you going to say something, Jerry?
Go ahead, Howie.
I was just going to say, actually, Jerry, I'm about to address some comments in the chat. Is there anything you wanted to
No,
say
I
about
think
Lisa?
I was agreeing with what Lisa was pointing out. These are other nuances that you have to think about. So yeah, why don't you go ahead and tackle one of the other comments there?
Great. So 2 great comments from Fabienne and Sasha. Fabienne says, prep with statistics of the overuse of restraints on people of color and explicitly state them in analysis and have a convo around it and what role we play. And I also just want to go to Sasha's because I think it's similar in context. He says, I would want race-based disparities in rates of restraint and other forms of coercions to be included in the objectives. These are excellent. So these are considerations that we need to take at the very beginning. This also helps to establish psychological safety for the learners during the simulation itself. And it also helps inform the direction and, Sasha, as you mentioned, the learning objectives that we will craft from this needs analysis.
It's fascinating because like oftentimes where does that conversation happen? It's in the debriefing oftentimes, right? And so the scenarios could be very much, you could focus on just the act of restraining an individual, or it could be so much more, right? Like you can actually unpeel the onion again and sort of get to some of these really deep core issues that most people would just gloss over. So good on all of you for identifying these type of issues.
In the interest of time, I'm just going to move on to the next phase. Let's say we're now moving into the design phase. So, and if you do have the HEI framework open, this would be on page 9. I'd love to hear some thoughts and feedbacks on some considerations you would all keep in mind for the design phase of this scenario. Remember, this is when we're crafting our learning objectives. This is when we're creating our blueprint, if you will, or our curriculum or overview of the scenario. It's when we're considering what types of methodologies and modalities that we would use at this phase 2.
Justin's got a comment there. Agreed, incorporating race as a social construct rather than biological one, that is taking a race conscious versus race-based approach would be important in intentionally incorporating racial identity into simulation. It's a question of how does being racialized affect the sim character experience of care and what should learners take away from it? Yeah. Thanks very much, Justin. Like that's a very important insight there into this.
Also, a great comment from Fabienne. Perhaps write a facilitator note to give learners an opportunity to choose which group they'd like to be a part of to help avoid possible triggering. I really like this point by Fabienne because it harkens back to the fact that we need to also be thinking of how to prep our facilitator and faculty during the design phase as well. Again, this would be the stage where folks are saying, okay, so we want to use a mannequin for this restraint simulation here. And we have these two groups and we have two mannequins, one that is dark skinned, one is white. Again, all important things to consider up front there. And I like how Fabienne harkened back to personal stressors or triggering for some folks too. So again, this is preparing the facilitator and faculty ahead of time. It's also helping the designers ahead of time too to consider this when when flushing out the curriculum or the simulated scenario. So next up, what would you all consider during the development phase? And again, if you're using the framework, that would be on page 12. So what are some things for development you would consider? This goes back to perhaps things like the case study that we talked about. It goes back to the different types of interactivity you might leverage based on the modality as well. I'll let that percolate for a little.
Yes, Lisa.
Hi, sorry, instead of typing this, I just wondered, and I may have this wrong, or I may not have looked at your information correctly, but in anywhere in the simulation, does it offer the opportunity, as opposed to be giving the learner the information about the case scenario, but an opportunity for the learner to pose questions of the simulation situation? So for instance, how does the simulator or patient in this case want to be addressed? How, like, do we offer an opportunity for the learner to utilize their already existing formulas or knowledge so that they can be identified as already, say, let's say, case sensitive? Does that make sense?
Yeah, no, Lisa, that's a great point. And I've actually never considered that before. I wonder, does anyone on the line have a comment for Lisa on that? I'm just thinking this through right now myself.
Yeah, I don't think sometimes in simulation we allow the learner to be present and to offer their already existing knowledge. And I think in simulation, we need to consider this so that we're not imposing the idea that, hey, this learner does not really understand, or maybe is a bit confused regarding identities or situations or language or all those sorts of things. And so maybe there has to be in the pre-brief,
Mm-hmm.
something that gives this up.
That's interesting. Like, I think there would be opportunities to bring those perspectives in, Lisa, and whether it may depend on the scenario or the situation that you're trying to design, whether or not that happens in the pre-brief or in the debrief. I would suspect, right? So if part of it is to dealing with sort of the stressful situation, you may put it into the debrief section. So that way the learner is experiencing the stress authentically in that space and then can process it. But you're not leaving it there unprocessed, right? Like, I think that's the other thing that we need to be willing to do as facilitators. And so that requires us to be also prepared, not just cognitively, but also like in the heart sort of space, to be ready to actually create a meaningful sort of safe conversation about that was tough. We know that was tough. That was intentionally, but this happens unfortunately every day in our health system. So how do we break this down? How do we prevent this from happening? And so there's a bit of a QI lens on this. There's a bit of we are collectively not getting it right. How do we prevent this from happening? How do we keep you from getting into trouble in these situations? So it all of a sudden becomes something like that. Yeah, Yasmin, I hope you have some insights for us compared
Hi.
to where I was sort of thinking about this. I
Yeah,
appreciate
I was trying to think about how to articulate what I was thinking. I think one of the challenges I see with is kind of applies to the conversation earlier about using labels about this is the Black patient, this is a white patient, and this is kind of conveyed in this case study as well, where it's
Yeah.
only depicted in the color of the mannequins. But there's so much more to a person than the label that you apply. And I think with EDIA, I think moving towards like having empathy for different types of people who are different from yourself and understanding their background, that kind of extra level of really, I think, adds that critical thinking instead of people just saying, oh, because this person is a person of color, I shouldn't use restraints. So I think like having some kind of incorporation of the patient's background or experiences, and especially in a simulation setting where you have the time to think about that. Whereas in real life, of course, things go much faster and we make automatic decisions, but taking advantage of simulation to think more critically about a patient's experience before going into these situations, I think would be a really cool way to take it to a next level and get people to go beyond what they would normally do.
Thank you, Yasmin. That's really helpful perspective. And to keep in mind, sometimes these decisions are very operational decisions. We have X number of groups, we have X number of mannequins, and so we use whatever mannequin we have. But we actually have to take a step back as educators, as facilitators of these sessions, designers of these sessions, to say, okay, are there potential problems? Maybe we do with one less group, right? And make the groups a little bit bigger because we don't, this group that we're engaging in, the learning objectives, it doesn't fit that it's, that we need to unpack this kind of conversation. Like that's something that we have to think about because sometimes our operational side of our centers or maybe even ourselves, our brains are thinking, I just got to get X number of groups and people through. And so we let this go, but there's risks. So it's the intentionality, thinking it through multiple angles. And this is where having a diversity of people in your planning committee will be really helpful. People from diverse perspectives, experiences, where I might not pick it up, Howie's going to pick it up, or Lisa's going to pick it up, or someone else is going to pick it up, right? Hopefully, like the more people that are looking at the case and the scenario and the logistics operational pieces, we can perhaps prevent this from happening, right? So I think that's the other lesson for us in this.
Jerry, I'm just wondering, in the interest of time, as we have 5 minutes left,
Yeah.
maybe we can skip the other two phases.
Mm-hmm.
We were kind of implementation and eval, and perhaps we can wrap up and then hear your wonderful questions as well. So I'm just going to thank you all for participating in this very short activity. Greatly appreciated. I'm just going to go now and finish up with some considerations. So EDIA is a journey. It can seem like an insurmountable effort at times, but remember, it's a journey and not a destination. It's an ongoing commitment, sorry, to learning. It's work, but it's work worth doing. Sometimes it's hard to know how to get started. I think it starts with asking questions and critically looking at why we do things the way we do. EDIA work is a marathon and not a sprint, and can be done at the system level, organizational level, and in all of our interactions with respect to simulation. So I would encourage you to start where you are, commit to learning, and realize that we're going to make mistakes, but commit to accountability and a growth mindset. So with that said, some basic points to take away: use a phased approach when it comes to designing and developing simulation and incorporating EDIA principles. Look at easy wins, identify top priorities, and always evaluate and review. And I do want to note there are some important things that we didn't cover today due to a lack of time, and we need to enhance for this type of presentation is around the pre-brief, which, Lisa, thanks to you, we touched on a little bit, but the pre-brief and debrief are huge components, as you all know, and we didn't get a chance to get there today, but please know that it is something that we realize must be addressed. And hopefully for the next iteration of this work, we will have some great commentary and information on those aspects going forward. Before we just get to questions, I just want to say again, if you need to access the framework at all, you can do so through here using this QR code. And on behalf of Jerry and I, thank you all so much for attending and for your valuable contributions. This has been fantastic. And Petal, thank you so much for inviting us to take part in this forum.
Oh, it's been a wonderful presentation. I just want to acknowledge that, this work is intense and it's complex. And we did do that Sim Expo workshop for 2 hours. And so, I think some of the nature and the sensitivity of the work that you're trying to convey here, I'm very grateful for all the participants and their engagement and their questions. And I think that we tried to do something very intense in 1 hour, but we know that we could have easily gone 2 hours, right? To cover all this material. So I appreciate you coming back again, Jerry, to SimCity Rounds, and I have a feeling it won't be your last time.
I'm always willing to, a lot of familiar faces on the panels here, so I'd love to come back. And and Fabian's got a full day training request here. There's no shortage of work.
See what I mean?
I think that's the interesting thing about this, is once you start, it is the onion. Like once you start peeling it, there's just more nuances and more areas that we just appreciate. I appreciate, and then once you see it, you can't unsee it. That's beware. Once you see it, you can't unsee it. So, but that's a powerful thing for the further work that you get to do.
And really the nidus for where change can begin, right? Yeah.
Thank you again.
Thank you all so much for coming, and we look forward to seeing you next month at our next SimCity Rounds, which promises to be extremely informative and relevant to our simulation work. Take care and have a great long weekend.
Thank you very much, everyone.
Thank you all.
Bye.